capabilities for detection, referral, or introduction to intervention with regard to order disabilities and abilities of learners. And K, to train and equip all teachers, including child development teachers and workers, principals, and administrators, and care providers as partners in the care development of education and advancement of learners with disability. The ECCD Council has initiated efforts to provide capacity building activities to the different ECCD stakeholders and its service provider in the LGUs. Included in their training is the early intervention. The conduct of pre-service and in-service training for child development workers and teachers includes topic on inclusion, special needs education as an early intervention. Also, the training of trainers on system for PERIDIC, which is very long, yields positive remarks on the timeliness and relevance to afford inclusion and awareness of understanding on system of processes needed to be established or strengthen the LGUs. On Section 12, the Individualized Educational IEP, preparation and review, wherein the IEP shall be developed for all children with learners' disabilities. This CCD requires special design and education support. The ECCD Council has developed an individual learning and development plan as a simpler version of the IEP. The ILDP was introduced to the guidebook on managing children with delays, disabilities. We had developed a guidebook in 2021 yet to guide child development workers and teachers and parents in accomplishing it as a counterpart of IEP to provide appropriate intervention based on the result of assessment and recommendation. The establishment of National Child Development Center in all cities and municipalities in countries remain to be a flagship program for the ECCD Council, built to serve as a convergent point in integrated services, laboratory, and resource center. It is also support inclusive learning that provides support and related services to teaching and learning and assessment of development domains to appropriate intervention and placement. As an active partner of the Development of the Republic Act 11650 multi-roadmap, the ECCD Council strongly supports the effective implementation of 11650 through collaboration with DepEd and other relevant government agencies, civil society organizations, and LGUs in ensuring that all children with disabilities access and receive appropriate support for early learning. In addition, Mr. Chair, we would like to inform you that even our infant and toddler, we already accept children with developmental delays. But we are using the checklist, they say the checklist, to be able to determine which of them are delayed, which of them are advanced, which of them are on track. So the parents, all the child development teacher and their supervisor, including our barangay nutrition scholar and barangay health worker, are trained on this referral system.
So I think it's without debate that the earlier we detect
Yes.
the disability of the child,
Yes.
the earlier government can give the necessary intervention, the necessary support,
Yes.
the better chances the child can cope up with life.
Yes.
So, so it's important that at the ECCD level,
Yes.
we already have a detection mechanism. No?
Yes.
One of in the law, one of the mechanisms that we included there is the child fine system. No? But I understand also from the briefing earlier on the implementation that the child fine system has not yet been implemented. We don't need an IRR for that. Because it's self-operationalization in child fine system. It's the funding that is necessary, correct? So how much do we need for the child fine system? Because in the law, it captures also 3 years old.
Yeah, Mr. Chair.
Yeah, go ahead, Dr.
Yeah.
Inchong. And then after...
We already have developed a child fine system in our own. It was sponsored by the UNICEF together with NCDA. We have developed that long time ago, but we included all the other agencies So we have, I mean, Mr. Edwin, you can, Mr. Talion can further detail.
Yeah. But in the law, DepEd is mandated to create that. So how much do we need in order to launch a child find system? Because this is meant to conduct early detection. No? Not only to encourage parents to bring their children to school, but also to detect disabilities through manifestation or to diagnosis. So, uh, how much do we need in order to do that child find system?
Mr. Chair, for 2025, for the establishment of a development of a child find system, we included in our wish list 200 million. 201,795,500.
Was that included? That's for nationwide?
Yes, yes po, for the development of the child find system, to include already the production of, to include the system design development, hardware and infrastructure, data integration and security, training and capacity building, maintenance and support, and there's a contingency fund that we included.
Was that included in the, it's a wish list, but was your wish granted? No? My staff who reviews the budget said no. So, well, again, no, it's that's why it's important that the roadmap is promulgated. The roadmap is has been issued, because in the roadmap also dictates the budgetary requirements.
Yes,
For
sir.
example, year one, this is how much do you need. Year two, this is how much do you need.
Yes.
So that we can help you. Senator Mbatoy and I can help you in lobbying for additional funds for the child find system and other programs. But we need to be guided. Kasi uso rin sa atin yung shotgun approach. We just throw a number, throw projects, and bahala na which one will be carried. But it has to be programmatic, meaning year one, this is what you need. Year one, the year two, this is what you need, so that we can allocate accordingly. Instead of just one number floated and bahala na if we will be accepted or not. No?
Actually, Mr. Chair, in the draft roadmap that we developed, that forms part already of.
Okay. So that's why, again, we boil down to the original problem, which is the IRR. No? Because that roadmap is not official yet, because the IRR has not yet been officially promulgated.
Yes, Mr. Chair. And it will definitely call, the moment we'll be able to develop the child find system, it will definitely call for partnerships with the LGUs, because we'll be needing a lot for us, we'll be needing a lot of personnel
Yes,
as
correct.
enumerators, because people have to go around and in every corner of the country to look for our learners with
I'll
disabilities.
show you a slide for, just to give the body an idea. Well, slide 2 first. It's good that the enrollment figures has gone up almost pre-pandemic levels, because the pandemic really did a lot of damage to the enrollment in our inclusive education modality or inclusive education program. Can you flash that, Carla? Pre-pandemic level is about 351,000 students. Of course, the pandemic hurt many students, and our learners with disabilities cannot go to school. But I also noticed that there's a slow climb with the enrollment, slow climb of the enrollment of our learners with disabilities. So it took them almost 3 years, almost 4 years actually, to reach close to pre-pandemic levels. So, but with that, I will show you on slide 4, we were estimating how many students should we have versus the universe. And there's no formal number that accounts learners with disabilities, and this might be DOH or the National Council for Disability or PSA. This is something that maybe DOH can look at. But UNICEF estimated